Hi, everyone. It's Dr. Clark White
And Dr. Scott Terry, we're back.
with Let's Talk About Health. It's been a while, a couple months.
Yep. And so we're here with new and exciting news and kind of keeping you updated on what's been going on. And so we're going to introduce our speaker, our guest speaker for today. So I'll let Dr. Clark White go do that part.
Dr. Erica Louden, she's actually a colleague and now she's a friend of mine, and we're excited to have her on with us today to talk about the new decision of the reversal of Roe versus Wade. Before she comes on, I'm going to just tell you a little bit about her. She's a highly skilled scientist and reproductive endocrinologist and infertility specialist. She focuses on all areas of reproductive health. She's done much research, efforts for focus on access to care for cancer and infertile patients, as well as the novel mechanism to preserve oocytes during chemo and radiation therapy. She's a graduate of Wayne State University School of Medicine. She completed her residency in OBGYN at Wayne State and her fellowship in reproductive endocrinology and infertility at Augusta University. We're very excited to have her here today. She's participated and she's been published a lot of research, authored textbooks, clinical trials, research covered in peer-reviewed publications. And we're excited to have her here to discuss with us her opinion and how it affects the women of reproductive age of the reversal of Roe versus Wade. Dr. Loudon?
Hi, hello. How are you,
We
ladies?
can't hear you.
Oh, thank you. Oh, gosh. Can you hear me?
We can't hear you.
Uh,
So maybe we will have you text what you want to say or type it, not text, type it, and we can read it. But while she's doing that, I don't know about you, but this whole new thing with the reversal of Roe versus Wade, it's frustrating to me. It's very disheartening. It's sad. I'm very sad about it.
It is. And this is not a political, not a opinion. This is just how it affects women in the United States. And it is not just one race of women. Some races will be affected more than others, but it completely affects women's lives and how they function. But it also affects men as well. And so this is something that for you, for health wise and health reasons, there are huge changes that are going to be occurring. And I would absolutely hate to see it go back to what it was before Roe versus Wade was started, because it was terrible.
It
So
was really
yeah,
terrible. A lot of maternal deaths. We know recently it's increased for everyone and more for Black moms.
yeah.
And before Roe versus Wade, a large percentage of had to do with unsafe abortions. And now we're going to add that back in. So I'm scared. I'm devastated actually. I feel like we've taken 10 steps back. And it's not about, like you said, it's not if you believe whether or not you believe in abortions. It's not about whether or not you think you would never have an abortion. It's about the government having power to tell us what to do with our bodies.
Hmm.
And it
Hmm.
just should not be that.
So the other thing that I'd probably like to say, and this, it was a question. There have been more men discussing vasectomies, um, and so one of the things that I want to make sure people know, especially young Black men and young men in general, vasectomies are not meant to be reversible. So that's something that I want people to just make sure that you're not going, especially if you're in states where they are not allowing any access. Because my other concern is that, so now they're talking about birth control.
Yep.
And so we started with the Roe versus Wade. Now we're talking about birth control.
And what's
What's
next?
next?
And
And so
even birth
that's,
control, should that be that it's scary. It's very
but
scary.
I think that that's, I don't know. I think that might be coming. So it is something that we just have to kind of pay attention to. We have to get involved. We have to go vote. And that's so that, we can maintain our individuality and be able to have, our whole purpose for starting this show was to actually increase and improve your health. This is going backwards a little bit.
It's going backwards a lot. And we do know that while we cannot hear Dr. Loudon, the audience could. So we're going to allow her to speak, and we just need a heads up when she's done.
Hi, thank you for having me on today to let's talk about health. I agree with what you ladies have already kind of broken into the conversation of is how this is setting us back. And it's kind of the big question is what is next if this happens? This is a big, huge thing for reproductive rights. And the scary part is people will find a way to still do abortions like they did before it became legal. And now you're affecting the health of women, where we know when this wasn't legal, people were still doing this and they were doing it and they called it back alley abortions because there were physicians or lay people doing them in hotel rooms and it was not safe, it was not sterile, and so it causes something called septic abortions, which it was cited that in one county in LA there was 2,000 septic abortions in 1 month when the time that it was illegal, and of that they were having like 1 death per week. And then there were women who were still having these babies since they couldn't have abortions, but then they were doing things to cover it up, like having these babies, but they were discarding the babies in the trash or throwing them in the river. So we're just going to see death, rape, crime, health issues. So this is going to be a health disparity thing as well, because who can afford to do this is marginalizing the people who can't afford to go to those states where it's still going to be legal, like California. Thank God we're still in Illinois, because right now we're not one of those states that's called trigger states that went right along with the Supreme Court that says, no, it's not, we're done. You can't do it as of today, and immediately lock down any options. Well, who can't afford to go travel to other states or go out of the country to get something done safely? That's going to be those who are low socioeconomic status. And so that's going to see changes in health disparity go up. So that's kind of the fear. So that's kind of one big portion of it. But then the next thing is what's next, as I mentioned, and as you two have said, is not Dr., but Supreme Court Justice Thomas has already said, well, now that we've done this, other human rights that we have taken for granted, like contraception or LGBTQ, same-sex marriages, those are things now that are on their radar. And all these things, the problem is they're looking at it a tunnel vision and not seeing the big picture. Like contraception is not just for preventing pregnancies. We use it for so many things in medicine. And so the Reproductive Health Act of 2019, we're about to see a lot of changes. And for me as an IVF and someone who's wanting to help people get families, we still are now kind of at the mercy of what the courts, that vague language, what are they going to determine this really means? Are your embryos, personhood is something they're talking about. Personhood, meaning is your embryo a person to have human rights and can have independent rights to say that we should not be, testing them, discarding them, or how many can you create? So there are lots of limitations, and I could go on and on about this topic, but I kind of want to hear what people want to know about because it's multifactorial. It's going to affect us on so many levels. So I guess I'll keep talking because I can't hear anything from that side of the studio. So American Society for Reproductive Medicine, which is our guiding body for reproductive endocrinology and fertility, they came out and made a big stance. We have it's called the Center for Policy and Leadership. And so we have lawyers. We are going to be working at the state levels, or we already are working at state levels to make sure that there is protection and things don't change. And their reproductive care can't continue without interference of the government, because this is a privacy thing. This is the other thing that opens up the can of worms. It should be a patient's autonomy, meaning you and your doctor, your partner, you decide after you know the risk, benefit, alternatives, what is best for you in your life. We have our first question, and it says, can I travel to another state to have the procedure without getting into trouble? Right now, the answer is yes. You can go to another state, and there are some states right now. We know there's 13 states, mostly like in the South and in the Midwest. In the Midwest, Illinois is the only state right now that is allowing, like Missouri next door won't, Wisconsin won't, Indiana, you are in trouble. But right now we are seeing influx from according to the family planning clinics, we're getting people coming into Illinois. Like they have 500 calls, people coming in to get taken care of for the things they need done. So you can right now legally travel. There are no laws that prohibit you from going to getting it done somewhere else. You just cannot get it in that state. The problem is this causes something called burden. There's burden put on now a woman or a couple who decide that they are not ready to have a child. Undue burden is the term that they use legally. So that undue burden, now, yes, you can go to it, but a lot of states have red tapes that they have put in place historically, like you have to watch a video 72 hours before your appointment. You have to answer some questions, a lot of red tape before you can do it. So you have to not only do that, qualify, buy your ticket, travel to that place. So it's placing undue burden on couples, on women who want to do this. But as of now, you can travel to other states. Always check your legislation, talk to your doctor though as well, just to make sure, because things are changing as we see overnight. For one thing that happened is once the Supreme Court justice made their decision, states automatically, as I mentioned, had trigger laws and they locked down things. People who were supposed to have procedures that day got canceled. And also now at the state level is where the policies are falling on too. Well, Pennsylvania, love you, brotherly love. But Pennsylvania has a bill now that's coming up that talks about personhood. It's the Personhood Act, where they want to say at time of conception, egg and sperm meet, that is now human life and has the right to live, and you cannot terminate. So what determines personhood? Is it an embryo? So it's kind of a lot of conundrum and vague language that is out there, and things are going to be changing at the state levels. So this is why it is so important to go out and vote, because these are the people who are representing you, and then you have to make sure that they are in line with what your beliefs are. Paulette has said it's a shame when it comes to this, because what if you get raped and you don't want the baby? Yes, that's the other issue that a lot of Americans found an issue with the Supreme Court. Not only did they ban abortion, but they made no leeway which shows no empathy for women who may have been raped, incest, or what about maternal health? We already know we have a maternal health disparity thing going on, where we, in a country where there's so many resources, we should never have a mom not get enough care and dying from something that's preventable. Well, maternal health, a lot of times we send our patients to get a consult from high-risk OB doctors, preconception. They tell us they shouldn't get pregnant. But if you get pregnant before we're able to give you birth control and IUD, which is now on the line for not being an option, you cannot terminate that pregnancy, even if it is going to cause jeopardy to your life, which is the other issue. The other part is this, as far as like maternal health. Well, what about fetal health? Is there a fetus that's born with a congenital anomaly? There's no leeway right now that you can have that choice before you get to full term to terminate that baby, even though you know it's going to be born with a lifelong health issue. Or even there are some of these that can die immediately after birth. Why subject to a woman or a family to having to go through 9 months, carry a life, and know that it's going to not be successful? Well, they took none of this into account, which is the problem that we face right now with our judicial system. Any other questions? I know I talk very fast too, because I'm passionate about this, because it's something that we would never thought we would get to this point. At least I didn't think, when Roe versus Wade happened in 1973 and passed, I wasn't even born. So I don't know any other way of life. So this is kind of like very difficult for many people. The next question was, what about the Plan B? Will it still be available? I went to a very interesting grand rounds presentation this morning. Grand rounds just means like the doctors meet once a week at hospital system, and they do continuing medical education. We talk about these topics. Right now, Plan B in some states are still available, most states. However, that is the issue right now. Abortion with that, medications that can contribute to abortions are going to be not available. And even the states like, say, Illinois, Plan B, something we call cytotec, which we give cytotec if a woman's had miscarriage. You want to just make sure that there's no products of conception, help them rid the pregnancy out of their body because they don't want surgery. IUD, all of these things are now at risk, even in the state of Illinois, because there's something that the pharmacy has. They have the right to refuse to dispense the medicine. And that's probably because a lot of times now fear is in their head that maybe they're going to face some repercussions and fines from the federal state government because they are giving these medications. So right now, Plan B is not available in those 13 states that to pull the trigger with the Supreme Court and says like abortions are outlawed. Right now, you can still get them in limited states. Will that continue? It may not, because as I just said, the pharmacy is not illegal for a pharmacist to refuse to give those medications if they think you are doing it for an abortion. And obviously, Plan B is not an abortion. It's to prevent in case there was a pregnancy that was about to happen. However, this is where, once again, the language in these legal documents are very vague and left to interpretation for a lawyer. And somebody can sue you. Like people can report you. That's kind of like the scare tactics. Like your neighbor, if they think they saw you doing something like they overheard you saying you were going to take Plan B. Now you can have a case. This is kind of those fear tactics and the things that are now going to prevent pharmacists and healthcare systems giving you appropriate care that you deserve. What other questions? That was a great question. So I had one of the doctors this morning asking, is there a way to sue a pharmacist or not sue, report pharmacists that if you write a prescription and they won't fill it, well, you don't need a prescription for Plan B, but things like Cytotec, the other one is methotrexate, which methotrexate is we use it for topics. Sometimes it's used in rheumatology, like if you have arthritic pains and things. Well, those things, if a pharmacist looks in and they think you might be doing it because you're 25, 30, your reproductive age, and you might be wanting to use it for terminating pregnancy, yes, they can refuse giving you that medication. And there's really nothing you can do about it except for go to another pharmacy and try to see if you can fill it somewhere else. Any other questions? I wish I could see Dr. Cordelia White Clark. Here's another question. Can a vasectomy be easily reversed? We answered that in the beginning. Vasectomies can be reversed, but whether there's going to be healthy sperm is the question. It's not meant to be reversed, but yes, men do reverse their vasectomies. The problem is from the time of vasectomy to the time that you reverse it, antibodies, meaning your own body can build up immunity and attack those cells. And so the number of sperm, the quality of that sperm is now going to be compromised. So if you were to have a vasectomy, a patient was supposed to have a vasectomy and they wanted to reverse it 2 years later, they're probably fine. But if you do that vasectomy and 10 years later, you decide you want to have another child and go to reverse it, you may have sperm, you may not. And the sperm that you have there is going to be compromised potentially. And that's kind of where we depend on our colleagues. My equivalent is our urologist who would do that procedure for you. And if there was a problem, guess what? If you really wanted to have another child, reproductive medicine is wonderful. You don't have to get a sperm vasectomy reversal. You could do testicular sperm extraction where a urologist can go in and extract part of the testes and then get sperm from that, because the sperm is stored in your testicles. It's made every 3 months. If you don't want to have an incision, because that means an incision on the testes, there's testicular sperm aspiration, where they go in and they just put a needle in, they aspirate and try to recover sperm. So do know that to have a child, you don't have to reverse it. If you are in a state where you have coverage, which is not, unfortunately, there's another issue. There's only 19 states in the U.S. that actually mandate that if you are there and you work for an employer, your employer has 500 employees, they have to give you coverage. So if you are in a state where you have coverage, no need to reverse it. You can do a TASI or a TASA to get sperm. If you're not, then obviously REI and IVF, those procedures may be a little bit out of reach. So I would say talk to your doctor, compare the cost of reversing it versus doing IVF with testicular sperm extraction. Hi, there you two are. I am just going on and on, but I want to engage with you too. I'm engaging with the audience, but there's so many facets to this topic. I want to engage with you too. I'm engaging with the audience, but there's so many facets to this topic.
Are we still muted? Okay, so we're listening to you on the phone because we can't hear you through the computer.
Okay, sorry. I don't know what's going on. But we do. we do have a question. What options do I have if I'm in a state where abortion is now illegal? You have the option to go into a state that is legal in. First, go to look on those like a family planning clinics there in the state that's legal right now. And I wish I could show it to you. I'm gonna put it up on the camera. You probably not be able to see that, but this is where you want to see. If this is somewhere published on, I believe, on a family planning site where you can see what states are black. Those that are black, it is now illegal. You will go to jail, so don't try it. But those that are like pink or light pink, it is still legal there. Those are the states. So for us in the Midwest, it's Illinois. Those on the West Coast, it's mostly California. Excuse me. So there are places you can still go to those family planning sites. You can even talk to your physician, and they may be able to direct you, but they can't do more than that because if it's illegal in your state, because then they're assisting you. And that's kind of the thing is now if the legal ramifications that you could be charged with manslaughter and homicide, a physician can't really help you in your state. So I tell you to take it independently and look at those avenues for yourself. But there are states, it's not illegal everywhere yet. Only 13 states have completely banned it to date. And those other states are bringing it at the state level during elections that are coming up in these bills in November, and the primaries going on right now. So you just have to definitely keep your eyes and ears open, pay attention, read what are their platforms, what are they saying about this issue? A lot of them may not say anything, but they have a stance on it. So if you get a chance to go to one of those interview sessions, I'm sure right now, because this is such a hot top button, all journalists are going to be asking candidates that question, see what their answer is. The next question was, is it causing a very different conversation for me as a parent with my daughter age 17, 27, 31? Wow. Different states, Alabama, Michigan, Texas. Yes. So you're going to kind of see those Republican, non-Republican kind of states. They're conservative and they're following suits with the ruling of the Supreme Court justice. And it is scary. And it's not so much about the abortion part. It's about even contraception. Well, we know abstinence. We can preach abstinence. People don't listen. They're going, kids have sex. Young adults are having sex. And you want them to be perfect. And we already know that practicing, like from data, practicing pull-out method, the old rhythm method, that stuff is not effective. Contraception is the way to go. Right now, you can get contraception. The thing that worries me is it is coming up potentially, according to them, that is going to be taken away. So a lot of people are running out here trying to get their IUDs. It is great. It lasts longer. You ain't got to worry about a pill. So it is a very different conversations that you have to have with your children now. Nobody is encouraging abortions. We're encouraging letting people have choices. We, as physicians, we don't push anything. We tell you what your options are, what are the pros and cons of both, and you make an informed decision. That's what should be allowed. And right now, that human right has been taken away in a lot of places. Yes, educate your babies because it is a new world. Next question is, what options do I have if I'm in a state where abortion is not legal? Okay, I think we answered that one. So you can go to other states. You can't go out of the country. I don't recommend that one unless like people used to go to Mexico. You can go to Mexico. I wouldn't go to Mexico, but there's Canada, there's other places. But once again, that's affecting people who may not have the resources and funds to go travel out of the country. So right now we have the luxury to go to intercontinental to those states that allow it. How does this ruling affect current pregnancies that have been determined as high risk that my doctor has recommended for abortion? Right now, that is the $1 million question. So abortions right now, according to the Supreme Court, is illegal, but it's now according to your state law. So you have to talk to your physician or go to your state legislative site and see what has been their decision. There's still a lot of states that haven't completely locked down on this. So you have the ability, but if your state is one where it's illegal, you may have to travel somewhere else. It's kind of what is on the books. Just like if you were just only 5 weeks pregnant, is early pregnancy. If you're already pregnant, it's high risk, probably from an MFM telling you shouldn't have this next child for your health reasons. then right now your option is to go to a state that it's legal in. Sorry, these are all, very difficult questions. All of it's legal, but there are resources. Once again, I'm always direct you. Your physician right now, if you're in an illegal state, may not be able to help you 100%, but there's the family planning clinics everywhere. Go to their website, look and see, because they know that these are the questions. We have seen influx even here in Illinois, where now patients who are residents here can't get it. They're on a list because people out of our state are coming here to get their procedures. The next statement was abortions in some states are illegal, even if it's a life-saving measure for the mother, like ectopic pregnancy. I'm scared about what that will impact, how this will impact women. Yes, that's the scary part. I think the ectopic one is a little gray area because we know an ectopic pregnancy is not a viable pregnancy for baby. Baby can't live anywhere outside of the uterus most of the time. There are some very rare cases, but most of the time. And so because of that, I think at the state levels, I'm hoping that the medical boards, like we have American Medical Association, we have SNMA, we have, for us as ARSRM, we have ABOG, and I'm throwing all these abbreviations to just say we have guiding bodies who are working with legislators because they have the medical expertise to say, okay, this is what the Supreme Court does, but there needs to be some exceptions. The topics are one of them, obviously, because if you rupture a topic and hemorrhage, if you don't live, baby don't live. That makes no sense to say a baby, unviable pregnancy most likely is more viable than saving your life. So I think that one is a little gray area where we're not going to be able to worry right now. Can I say that with 100% certainty? No, but the hope and the guiding principles are there are going to be some exceptions for things that are life-threatening is kind of the plan. What do you two ladies have to add to this, Karen? I don't want to take all the time because I want to hear your perspective and what your patients have been coming to you, because I know that's really ours is like, how is this going to affect IVF? And right now it hasn't until they bring in personhood of the embryo. When does that start? Right now it hasn't until they bring in personhood of the embryo.
Sorry, Erica, there's some technical difficulties. So we can hear you sometimes, and I think sometimes we can't. Or we can hear you, but you can't hear us. Well, I don't know. I just know there's some technical.
We're listening to you on a phone. So that's
it's not working on the live. Mm-hmm. But I'm also concerned about training because of those trigger states. I think it's like 22 of them where it's automatically outlawed. So what is that going to mean going forward just for training physicians who are trained in that? Are we going to have to stop training them because you can't get the training everywhere? That's something else we have to worry about. And then down the line, it's going to become more and more unsafe because people are going to try and find a way to have it done just like they did before the Roe versus Wade. And it was unsafe. And we had an increase in maternal death because of it. So that's what I'm afraid of as well.
Mm-hmm. We're also going to get a picture of the states that you showed early, Dr. Louden, so that we can actually share that with the audience. So they'll know which states is a hard no, which ones are allowed. Yes, that's the picture. So we'll actually put that on the site so people can still go back and refer to it. Because that's a really good, helpful, because people have families other places. And so they want to make sure that, they know these things are, this is where you can go, this is where you can't go. I know that there have been multiple groups that are trying to raise funding for people who need to travel to a different state to have a procedure. But it is unfortunate. And once again, I'm not saying you should or you shouldn't have an abortion. That's not my decision. So that is the biggest thing that is hurting women is that you now have no decision in it anymore. Someone else has made that decision for you. So that's one of the biggest concerns. But we definitely, you have given some really good information as far as what people can do, where they can go. None of us know what the next step is because it depends on the courts. But we have to go vote. Like,
we definitely
you
have to go vote. And
Yeah.
like you said, I never saw this coming. I just knew it was a no-brainer. I just thought it wasn't going to happen.
Mm-hmm. Absolutely. Yeah, that's absolutely right. And it all started because of Mississippi issue at the state level. And they took it to the Supreme Courts. They weren't looking for a reversal. They just were looking for a small decision with one case, and it blew it kind of nationally. And now we're dealing with the ramifications of that. I feel like it's going to come full circle, but only after they realize how much death and destruction and issues that it's going to cause is the problem. Life's being compromised. It's kind of the concern of why do we have to go there before you realize this is not the way to go. Because when I was listening to this talk this morning, the first decision for Roe versus Wade, how it kind of really came into effect, because it took years for that decision to come about. But they had a very well-educated 21-year-old school teacher who was in a state that it was illegal in, and her name was Goreen Sortano. I probably pronouncing it around 1963 or 64. So before they actually reversed it, and she could not get a termination and had found herself pregnant. She went and she did this in a hotel, and whoever did it, she hemorrhaged on the floor in the hotel, and this picture got put in the papers, and she was Caucasian. And from that, then the world started to look at how this is affecting. And she wasn't the only case, but she was the one that got media attention, that this maybe we need to let it be done legally so that it can be done safely is kind of what we want. And so I was asked to repeat kind of some of those statistics. So at that time when it was illegal, septic abortions were very high. And it was in LA County, it was 2,000 per week admissions to the hospital for septic abortions. And septic abortions just means that you end up getting infection in your uterus and your pelvis from having a non-sterile procedure done, because people were doing crazy things like hangers because they don't have medical instruments. They're doing this illegal. And as a result, people were dying because if you don't get infection treated in time, it goes systemic throughout your whole body, infects multiple organs. And so here in Chicago, in our Cook County area, there was 1 death per week in those IC units where they were getting these high emissions from septic abortions. So we don't want to go back to that time frame, but the fear is that we will get there because people will find a way to do what they want to do. But let's make it legal so they can do it within reason without compromising their health. Or at least give them the choice. Because once again, this is not a pro-abortion or pro-life. It is a pro-choice for me. So give people the option. Don't take it off the table completely. So I don't know how much time we have, but I can talk more and more if you like. So I'm going to touch a little bit on the REI side before we wrap up. So right now, I keep bringing up that term personhood, like when is life begin? That's been always the $1 million question for multiple posts on multiple sides. Is it at the time of sperm and egg meeting? So that's conception. Some believe that it doesn't happen till after birth. And some believe it happens in the second trimester when cognitive function we know has more fully developed. And so right now that is at some of the state levels is a bill that's being pushed to say that it happens as soon as egg and sperm meets. Well, for us in the reproductive endocrinology world where we're doing IVF, helping create babies, well, that is the conundrum we face now is if that is we're going to give that personhood and say that's life, then does that now dictate, when you have an abnormal embryo that we get, can we not, patients don't want us to transfer a baby that's going to have trisomy 21. Does that now mean that the court can dictate and say that you have to use that embryo? You can't discard the embryo. So those are some of those things. Are there going to be some limitations placed if we say that is not a person? Well, you're not wanting to fertilize, if you get 20 eggs in an IVF cycle and you get 10 embryos out of that, well, is that going to dissuade patients that we're going to have some restrictions, say we can't create that many embryos because you're not going to ever transfer 10 embryos. You don't want 10 children. So there's a lot of little technical things we are concerned about how the language of these laws are going to be translated at the state level, which is going to affect further medical care for people who should have reproductive rights to make the decisions that's best for them and their families. And I'm going to turn it over to Dr. Clark White. She tells me to call her Cordia, but I still call her Doc because I still feel like I'm always a resident. It hasn't been that long enough, but it hasn't been that long. Any other questions from our audience, though, before we wrap up? No questions. I thought I would have like unending questions with this. So done with the whole IVF, because right now it's not affecting care. We are working with legislator. We talked about the contraception thing. That's the next topic that the Supreme Court wants to come on. Why is that an issue? Well, contraception is not just for preventing birth or pregnancies. It's used for endometriosis, pelvic pain, polycystic ovary syndromes to regulate your cycles. So birth control is used on multiple levels. It's also used to reduce risk of uterine cancer for endometrial hyperplasia. So it's multifactorial. This should not be a blanket statement that contraception is for preventing pregnancy and thus is seen as part of the abortion pathway. That is complete nonsense. And so that's another reason why we need to go out there and vote. We're going to say that over and over. Obviously, as far as like people having the right to marry whoever they want, these are, again, all these things are human rights things that we are concerned are on the table, because this first great big one has been brought down. There's more to come, as they have alluded to. And so that is why, once again, please go vote. Let's talk about health, ladies. Oh, thank you. She said, all of you ladies, thanks for bringing light to this. You are amazing.
Can you hear us?
Yes, I can hear you.
Okay. And you have done an amazing job with, giving the information to our audience. And we want everyone to share this information so that other people, if they miss this podcast, they'll still be able to obtain the information. Dr. White, we are glad that she brought you on. And so I don't know, do we have any other questions? Do we have any other questions?
I needed IVF last year because my period got so heavy post-birth with my 3 kids. Had a hysteroscopy and didn't help. I was labeled anemic because of my cycles and lack of vitamin D, thyroid, and iron. Yes, and we hope people can still be able to get the care that they need, whether it's IVF and having babies or whether it's determining that a baby is not right at this time. With either one, I always tell people who have this debate, like they talk about regrets. You have regrets with everything in life, but until you've said with a woman who's scared about her future because she did not mean to get pregnant, fear is a very powerful thing. And yes, fear shouldn't drive your decisions, but it's something until you've walked in that person's shoes, we should not judge what they choose to do, because if you haven't been there, you don't know the terror and the things that they are weighing on their minds. And so sometimes they choose, even despite the fear, to go for it and have that child. Sometimes that fear and all those other negatives that they have in their mind tells them to go for it and not have a child. At the end, I think both sides have regrets, because there's a regret like, what would have happened if I had that child? And then some have that child and say, I could have went to college if I didn't have a child at 13. So you really can't debate. This is like a never-ending, ongoing topic we can always discuss. And then somebody said IUD. Okay, you had an IUD, not IVF. Okay, yes, IUD. So yes, we hope that they don't take our IUDs away. I'm telling everybody, go get your IUD if you're not having babies. They're great. They're afraid to have something. Their IUDs are very effective. They work, and the bonus is you may not have a period with it. So you knock out two things. But yes, that is awesome. I encourage everyone to share this live. I've seen so much bad information discussed on this topic. Yes, please share with others because it is so much bad information very important.
Thank you again, Erica, for coming on. It's been very informative and it's been great. I totally agree with you. The biggest thing is it's not whether or not you believe in abortion. It's not about what you would do. It's more about not having the right to have that decision, which is huge. I'm just devastated. And I said it at the beginning. I'm just very devastated by this decision. And it's important for us to go out and vote to help make a change if we're really devastated, if we really want to see things changed.
And not just this, but other things are coming. And so this was the first blow. But imagine, I mean, once again, as Erica said, we treat people with birth control, not just for contraception. We treat them for medical reasons. And so if we start going down that, it's a slippery slope. Once you start heading down that way, you don't know where you're going to end up. So we just have to really be mindful and really pay attention about who you are actually voting for and what you want to see as women, as men, going forward. But we just have to, I mean, we live in America, so we just have to, our biggest thing is that us having rights, and so those rights were just taken away
in America.
In America.
Land of the free, home of the brave. Please keep your period tracking apps. I put that out there because people are talking about deleting it. Please know when your period's coming. It's not about timing pregnancy and all those things. Keep your apps. They can't take that from you yet.
Still having technical difficulties. We do apologize. But if there are no more questions, we're going to go ahead and end. And thank you again, Dr. Louden. We will have some questions later that will be posted if you can answer those.
Absolutely. I look forward to it. Thank you for having me. Sorry about the technical difficulties. I don't know. I can hear you very well, but I don't know why you can't hear me, but we'll figure it out for the next one. Take care.